definitely took his barefoot, long toenails, and grazed my chin. What's up, you guys? Hey, you guys, welcome back to Nurse Talk. If you're new to Nurse Talk, welcome. And if you are an OG, welcome back. Here on Nurse Talk, we like to talk about nursing trending topics, and then we dazzle in a little travel content in there too. So if that's something you're interested in, go ahead and like and subscribe and keep up with us.
So today we are talking about patients assaulting nurses, family members assaulting nurses, anybody assaulting nurses, okay?
We are out here getting our beat.
Yes, for real. So we're going to give you guys 5 things that you should do in the case of an assault to help you guys out. And hopefully you never find yourself in this situation, but it can happen.
Yeah, has a patient ever assaulted you?
I mean, they've tried to swing before.
Okay. I had a patient kick me in the neck. Remember, we were trying to push restraints on a patient, and yeah, he definitely took his barefoot, long toenails, and grazed my chin.
Right.
I remember that day.
Or how about that patient? I think we both had him before, but it was one where he would, like, when you're doing IVs or something, he would just kind of reach around and
oh my gosh, yes, yes, he was
Yeah.
another one in restraints, right?
Yeah.
I remember that.
Yeah.
But all in all, patients are not supposed to be putting their hands on us. Patients are not supposed to be verbally abusing us, physically abusing us. This is not a part of the job. This is not what we signed up for. It's not included in our hourly rate.
Yeah, because you wouldn't go to the grocery store and if they're out of milk, punch the cashier in the face, right? That doesn't make sense. We should be safe when we come to work, and we should feel safe as well.
Right. So that brings us to our first point.
Never accept violence as part of the job. A lot of times we tend to brush things off and say like, oh, he didn't mean it.
Right.
Or, oh, she was drunk. Like something like that. But that is not okay, regardless. All right. This is stuff that would not be tolerated in the outside world. So it shouldn't be tolerated inside of the walls of the hospital either.
Very true. So one thing you should do if an assault does take place, I would file a report, make sure your supervisor knows what's going on. If there was a witness there, make sure the witness is able to leave a statement. Maybe call security at that time too. So it's all kind of logged when, what time the whole incident occurred. You can press charges on these patients.
Right, you can. I think sometimes a lot of people don't realize that you can file a police report and things like that and take like the proper procedures as if you were, you know, on the street and was assaulted by somebody. So you can take those steps. To piggyback off what you were saying is trauma counseling. A lot of times things happen to people and you don't know how to process it. So in order to get help processing, counseling might be a good choice for you. It might be something that you don't think you need maybe, but just try it out. See how it helps, because counseling does help people.
Yeah, it does. The assaults that we mentioned earlier in this video, they were confused patients.
Yes.
It's a different ball game when someone is in the right state of mind and they know exactly what's going on. When they're confused, patients that are going through withdrawal, because they're oftentimes hallucinating, even though it's not right, I think I'm more understanding of the situation. But what if you're left injured though?
Right, you still should report it, regardless of what ends up happening with that patient, even if they're in a confused state, because just because they're confused doesn't mean they can't cause any type of injury to you. Absolutely. So you want to make sure that you're getting the proper care that you're supposed to.
Make sure you're supporting your coworkers who have been assaulted. That's something, like we talked about trauma counseling, but sometimes being assaulted by anyone can definitely leave someone with trauma. So that's one of those instances where you want to make sure that your coworker feels safe. Maybe after that, your coworker won't feel comfortable being alone with patients or certain types of patients. So, and those are instances we need to be understanding and helpful to our coworkers.
So another way you can also get involved with assault, whether you've been assaulted or not, you can advocate for adequate organizational policies. So you want to make sure that your hospital or facility, wherever you work, has
a protocol.
Right. So when things happen, you know what steps you should take in an assault situation.
Right.
So you can help with coming up with ideas and kind of bringing along that process of getting a policy in place.
What would be helpful too if something was in place for our patients? I don't think I've worked at a facility where it's like, okay, if you assault your nurse or the staff, this is what's going to happen to you.
Right.
We've had something like a behavior contract where we've
Right.
had,
I've seen those.
where you're like, patients are just acting a damn fool, and then they're like, okay, well, you know, you need to act accordingly. But I feel like those never really hold any real weight or
Right.
any real consequences or anything.
But yeah, the contracts are kind of set up to where they make this claim that they're gonna, you know, kick you out or whatever, but then they keep doing the same thing. Like they test the waters a little bit, see what they can do, what they can get away with, and before you know it, they're back to the same crap that they were doing before.
I have worked with a physician before. It was a urologist. The patient was so mean to everyone, and it got to a point where he was disrespectful to the nursing staff, the support staff, his team, and anybody else that was consulted. To the urologist was like, we're not going to accept this behavior. So if you want our help, there's a way to act, and if not, I will discharge you. All right, and all. And he did. He wrote in all the patient's notes that the issue is still ongoing. However, I refuse to care for the patient because he's not like compliant with our standards.
Right. Well, good for him. 'Cause
Yeah.
that almost never happened.
Rare occasion.
Which I think it's a matter of being afraid of what the fallback will be. Like if you discharge a patient, and like if a patient leaves AMA, that's on them.
Right.
But if you discharge a patient saying, I'm not going to treat you anymore, and something happens, then, you know, there might be that liability. So there's got to be some sort of like gray area where a situation like this,
it's okay.
right, that
It's
you're
okay.
vindicated in what you're doing, because it's not really fair.
And that's what really needs to happen moving forward. We need to be able to advocate for ourselves just as hard as we're advocating for our patients. These are things that you need to consider because nursing abuse, hospital staff abuse has been something that is just too common.
Yeah, it's been ongoing.
Too common.
And then I don't think they do enough training. Like we do the little like modules on the computer where it's like, oh, workplace violence, who can you contact? That's all well and good that we know the numbers, but like real life scenarios, just like a code, there's real life scenarios that you go through for that. What do you do in a situation where you're in a room with a patient that throws something at you or corners you or things like that? What are the rights that the hospital staff have that they can exercise? So even knowing techniques for de-escalation,
yeah,
that's definitely important, so we don't get to that point.
Yeah. You guys got to know what's in place to protect you, and you want to do the best that you can to keep yourself and your patients safe.
Right. And know it ahead of time too. Don't wait until it happens to be like, what number am I supposed to call? And also you can join nursing groups to advocate for legislation as well, which kind of ties into what we said earlier. But you know, just like there's petitions to save the wells or, you know, whatever is near and dear to your heart, this too can be something that you advocate for and work with legislation to actually change and make repairs to our faulty system that we have right now.
So that concludes patient assault
and what you can do in a case that it does happen to you, which we again hope it doesn't.
Right. Tell us the situation that you've been in or you've seen, whatever the case may be, but be a part of the conversation.
Right.
We want to hear from you.
So if you like this video, and make sure you subscribe and hit the bell notification so you'll be a part of every conversation that Nurse Talk has.
Right. So we'll see you next time.
See ya.
Bye.
Bye.